Okay, good morning. We are now officially done with CPR and AED.
Heck yeah.
Okay, done with the mannequins. We will move into the first aid stuff. The first thing we start talking about is bleeding. Today I'm going to talk about bleeding externally, and then tomorrow I'll talk about internal bleeding. We'll also do a hands-on test for bleeding tomorrow. So you need your gauze roller and your gauze wrap with you tomorrow. So bring your plastic bag with your supplies in it. That will be the last time you will actually need those things. So have those with you tomorrow for me, please. On Friday, we're going to do an activity called Putting It All Together, where I will give out some different scenarios and some chart paper, and you're going to have to work through it and share it with us just exactly how you decided to come up with the steps to take action in an emergency situation. It will go outside of the normal CPR AED stuff because we're done talking about that. Your tests are graded. You guys did a great job. I will have those up online today or tomorrow. I was pretty happy with your efforts though in this class. It seemed like you got it. Either that or I did a good job of preparing you for it, or a combination of both. Okay. This week, current event is not going to be due. It's going to be due next Friday. And there will be two groups that are accountable. It'll be the blue group, which is Dara, Lorenzo, Hassan, David, and it will be the yellow group, Sophia, Jacqueline, Chris, Dylan, and Catherine. So it's your third one for the semester, your first one for the quarter. You have two more due in this quarter, and that's it for the current events. Had some really good articles last time, some really good current events that I enjoyed looking through. So keep it up. All right, so bleeding. I have a little clip to start with. This is kind of interesting. This is like a did you know clip.
Yes, I did know, Bob.
Have you ever wondered why some people faint at the sight of blood? Fear of blood is classified as a phobia, which is an intense, irrational fear of something that causes your body to react by going into fight or flight mode. But unlike other phobias, the fear of blood, along with injury and injection phobias, can actually cause a person's blood pressure and heart rate to go up and then suddenly drop, which can cause them to lose consciousness amongst other symptoms. A certain nerve, called the vagus nerve, causes the drop in blood pressure when it is triggered by certain external stimuli like pain, dehydration, sudden fear, among other causes. Scientists think that the nervous system reaction may be an evolutionary trait that lowers blood pressure at the sight of blood to prevent bleeding to death. Researchers have found an effective way to cure certain phobias. The phobic person has to tense up and then be exposed to whatever they are afraid of little by little. In the case of a blood phobia, they show the phobic person a spot of red, and then a larger spot of red, then a picture of blood, then real blood. Tensing up stops the drop in blood pressure from happening. Around 3 or 4% of people have a blood, injury, or injection phobia.
Okay. So I thought that was kind of neat with that phobia
And
thing.
that tin piece about.
All right. Our objective over the next few days to be able to understand the types of bleeding, the types of blood vessels that we have, how to control external bleeding, how to control internal bleeding. What you're going to find is with internal bleeding, it's very much the same signs as you get for shock. So it just shows you how serious internal bleeding can be. All right? Bleeding. In your packets, page 1, I believe. Bleeding. It's the escape of blood from arteries, capillaries, and veins. External goes outside of your body. Internal is inside your body. How will we know if we have internal bleeding?
See a little red spot.
You could see a red spot, or what other color?
Blue.
Blue, exactly. Black and blue spot. That means you're having some internal bleeding. Along with internal bleeding and the color of your skin changing, there's swelling.
Can't that kill you?
Can internal bleeding kill you?
Yeah.
Yes, absolutely.
You drown in your own blood.
What? That's nice.
If you hemorrhage,
Mm-hmm.
yeah.
Isn't that what pregnant women do?
pregnant women bleed a lot?
No. I heard that on Grey's Anatomy. When the girl was pregnant and then she was like, you're hemorrhaging or whatever.
Having heavy bleeding, that can happen.
Okay.
That can happen. If you look at this illustration right here for me, this red thick line right here is an artery. It's pulling blood away from the heart to other parts of your body. This blue thick line right here is a vein. It's taking it back to your heart. And these two oval-like things in the middle that have a collaboration of both colors, those are capillaries. And they tie together your arteries and your veins. So those are some important things you need to understand. Everybody good? Okay. When bleeding occurs, your brain, your heart, your lungs, they all attempt to compensate for it. They want to keep the blood flow normal, but it doesn't happen like that. They want your vital organs to still continue to function the way they were prior to the bleeding happening, but it doesn't function like that. That's why solving the issue of where the bleeding is coming from and getting it to stop is so critical. You have 3 different types of bleeding that can occur. The most dangerous type is called the arterial bleeding. Okay? And the arterial bleeding is fast, it spurts from a wound, and the blood is bright red. So everybody's seen like a horror movie or something like that. Okay?
Yes.
And like, you know, somebody's murdered in that horror movie. Or you've seen some sort of movie where somebody might have gotten their throat cut. Something crazy like that. And the blood comes squirting out really hard and dark red or bright red. That's arterial bleeding. Now vein bleeding, capillary bleeding, they're a little different. Vein bleeding and capillary bleeding are what we're most accustomed to dealing with. Vein bleeding, it's easier to control, and the blood is usually a darker red or a maroon color. The capillary bleeding, it's just like a paper cut or something like that where we scratch the surface and the blood just kind of oozes out. It'll clot easily. If you look at those 3 types of bleeding, going from bottom to top is the easiest way to control. Capillary is very easy. Vein is a little bit easier. Artery bleeding can be very dangerous. We're going to talk about how dangerous it can be when I show you a tourniquet. My least favorite type of cut ever to get though is a paper cut, which is a simple capillary bleeding, but it's so annoying.
Especially at work when you take the sauces out of the thing, they be cutting you, you're so mad.
Right.
Oh, yeah.
How we doing? We good? Okay. Oh, I have a great video clip for you. I want you to watch this one. This is about the circulation of your blood.
There's a great new craze that's sweeping the nation. Come on, do circulation. Starts with your heart, what a great sensation. Come on, do circulation. Out through your arteries, into your veins. Your heart pumps blood, then it does it again. So come on, everyone, get it on, everyone. Circulation. So come on, everybody, exercise your body for circulation. Circulation, everybody form a circle now. Circulation, not your blood, you just start moving around. Circulation is the function that's so outside. And if your feet fall asleep, then you're not circulating right. You got 4 heart parts to pump the blood. Yeah, that's circulation. Left and right ventricle, left and right atrium. Yeah, they do it. They circulate, they pump blood through your lungs for oxygen, and then the arteries take it through to your body, and your veins bring the old blood back to be renewed. Circulation takes nutrition to your cells and gets rid of carbon dioxide and waste as well. Circulation is the function that's so outside, and if your hands are cold, then you're not circulating right. Well, your blood is such a life-giving potion. Like a river, it's always in motion. From your head to your toes, doing good as it goes. It's a big red beautiful lotion. Now the blood's not bad, it's kind of special. Yeah, come dig it, circulate with red and white corpuscle cells. Yeah, come do it, circulation. Red cells carry oxygen, white cells fight the germs. So come on, come do it, yeah, come do it, circulation. So come on, come do it, come do it, circulation. Circulation, everybody form a circle now. Circulation, like your blood, you just start moving around. Circulation is the function that's so outside. You'll be circulating right. There's a great new craze that's sweeping the nation. Come on, do circulation. Starts with your heart, what a great sensation. Come do it, circulate out through your arteries, in through your veins. Your heart pumps your blood, then it does it again. Come on, everybody, get it on, everybody. Circulation. So come on, everybody, get it on, everybody. The circulation, the circulation.
It's one of my favorites. Okay. No, we're not watching that one. Thank you for asking, Dara. All right. But what we are going to watch is how to control that bleeding, okay? This is pretty straightforward. It's going to show you how to control bleeding, how to wrap somebody who's bleeding without something in their body, and then they're going to show you how to wrap somebody who may have like something that's stuck in their body, like a piece of glass or something. So it's kind of important to know this.
When a person's skin is broken and bleeding, she has an open wound. Most open wounds will stop bleeding on their own after a few minutes. In cases of severe bleeding, have someone call 911 or the local emergency number immediately. Check the scene for safety. Obtain consent to give care. Check the person. Follow standard precautions, including gloves and other personal protective equipment when providing care. Cover the wound with a sterile dressing or clean cloth. Apply pressure on the wound until the bleeding stops. Wrap a roller bandage around the dressing to secure it in place and keep pressure on the wound. Start from the end farthest from the heart. Overlap the roller bandage several times to completely cover the dressing. Tape or tie off the end of the bandage to keep it in place and keep pressure on the wound. If bleeding does not stop, do not remove the blood-soaked bandages and dressings. Apply additional dressings and bandages and continue to apply pressure. Do not attempt to wash or clean a severely bleeding wound. Your first priority is to control the bleeding. Take steps to minimize shock and call 911 or the local emergency number if you haven't already done so. In cases where an object is embedded or impaled in a person's skin, caring for the wound is slightly different. Do not remove the object. Removing it may cause more damage. Keep the object and the body parts still. Place gauze dressings around the object. Lightly press the area around the wound, but do not press on or move the object. Surround the object with bulky dressings to keep it from moving. Carefully wrap a roller bandage over the dressings and around the object, but do not cover the object itself. Overlap the bandage until the dressings and object are completely secure, then tie or tape the bandage in place. Monitor the person's condition until a trained responder or EMS personnel take over. If bleeding continues, apply more bandages and maintain pressure.
Okay, so you can understand how it's important to recognize that if something is in somebody's body, that you leave it there. You wrap around it. You guys remember Steve Irwin, the crocodile hunter?
Yeah, he died because he took it out.
Yeah, he had that, was it stingray?
Yeah, stingray.
Yeah,
shot him in the
stingray.
heart.
Stung him in the heart. If he would have just gotten himself out of the water where he was, there was always paramedics there, EMTs there on site for him because he did some pretty risque things, okay? They would have cut that thing down to a position where they could just keep it in there, taking care of him until they could have got him to a hospital, and he potentially could have lived. But our natural reaction to something like that is something goes in, we want to pull it out, right? I mean, that's just a natural reaction. That's what he did. He bled to death. He didn't even have a chance. He didn't even have a chance.
He had all that knowledge of those animals.
He what?
He had all that knowledge of those animals, but he
Right.
still took it out.
But you know, it's just a natural
Yeah.
instinct. You know, let's say you're outside and you're running around and you fall on the field while you're practicing and there's glass on the field and you get glass in there, you're going to be like, ah, and you're going to want to rip it out of there because it hurts. But that's not really the right thing to do, especially if it's embedded deep. Here's a great story for you. When I was growing up, one of my buddies had his graduation party, and back in Western Pennsylvania, they had clotheslines where you would hang your clothes out in the fresh air to dry instead of using a dryer. And they were poles and they had hooks on the end of it for you to run rope on and then hang your clothes over it. Well, we're at my buddy's graduation party and his parents had these two clothes poles in the yard and we're playing football, throwing the football around, and my one buddy jumps up to catch a football and he lands on the hook with his arm, right underneath his arm. Oh, it was vicious. It was vicious. But the hook went really deep into his arm. So we helped him get off of there, and he was kind of like in shock that this happened. Well, luckily, the kid whose graduation party was, his mother was a nurse. So we called her up. We're like, Mrs. C, we need your help. So she comes up, and Dave's standing there. His name was Dave Gear. He's standing there holding his arm, and she's like, oh, let me see, Dave. It'll be okay. There was no blood. It went in so deep, it didn't hit anything, which was the weirdest thing. So she's looking at it, and she's like, oh, you know, she's like, because it was deep. It was really deep in his arm. So she's like, well, we're going to have to get you to the hospital. You're going to need some stitches. And he's like, okay. You know, he's very calm. She gets the whole don't let a person go into shock type of thing. Well, I had this one goofball friend of mine who, you know, he was just that guy. And he comes up and he's like, hey, here, let me check it out. And he lifts his arm up and he sees like inside of it. And he's like, oh my God, man, you should see this. I can see inside your arm, the muscle and everything. And my buddy just kind of, he passed out right there. It turned into a worse scene. They actually had to call the ambulance because of all that. But, you know, it's going to happen. it's going to happen that somebody gets cut severely like that. You want to keep them calm. Okay, you want to keep them calm. If there's something in their arm, you want to leave it in their arm. You want to wrap around it. Let the professionals take care of that. What type of blood vessel do you think that glass went into? People?
Arterial.
Artery, exactly. Arterial, exactly.
So I thought you said there was no blood.
Not my friend. I'm talking about right here in the video. Yeah. All right. So a tourniquet. A tourniquet should be used only as a last resort. If you know the EMTs aren't going to get to you quick enough, if all that pressure you're putting on that cut is not working, it's not stopping the blood, and you can't apply any more pressure, a tourniquet is an alternative. What a tourniquet does is it cuts off the flow of the blood to that particular area. So if I'm bleeding in my arm, in my upper arm, I'm going to put a tourniquet somewhere around the top of my arm if I meet those criteria so that I don't bleed out and bleed to death. But make no mistake about it, everybody, a tourniquet is extremely dangerous to play with. If you use a tourniquet, there's a chance you could lose a limb. Okay? So make sure you understand that aspect of it. I actually had ordered a professional tourniquet to be able to show you guys, but it never came in. So I'm going to show you the video clip here so you understand it and kind of talk you through a couple of different little things about it. But you can use anything that you can tie off really tight and stop the flow of the blood. Did you say somebody have a question?
No.
Okay.
In cases when bleeding cannot be stopped, tourniquets might be used. Resorting to a tourniquet is rare, but if you must use one, manufactured tourniquets are preferred over makeshift devices. Always follow the manufacturer's instructions. Tourniquets might be used on an arm or leg if you cannot control bleeding with direct pressure, or if direct pressure is not possible. Position the tourniquet around the limb approximately 2 inches or 2 finger widths above the wound, but not over a joint. If necessary, route the tag end of the strap through the buckle. Pull the strap tightly and secure it in place. Twist the tourniquet rod until the bleeding stops. Then secure the rod in place. Do not cover the tourniquet with clothing. Note the time you applied the tourniquet and give this information to more advanced medical personnel. Keep the tourniquet in place and care for shock until EMS personnel take over.
Okay, so note the time, because when that professional arrives, or those professionals arrive, we want them to be able to look at that time and understand how long you've had that tourniquet on there, how long it's going to take before they can get you help, and when you get to the hospital, if they're going to be able to save that, or if, you know, they have to get rid of that limb because it's dead now. Because those nerve endings and everything that entails underneath that tourniquet will die eventually without the flow of blood there and the flow of oxygen. So that's why it's important to have that time written on there. Okay, if you don't have something to write a time with, which is feasibly possible, you have to note that yourself though. That's something that's extremely important. Additionally, if you're going to apply a tourniquet, make sure that you apply it to the degree that it does stop the blood. Don't put something on there just to put it on there and it doesn't work like it should. Okay, this guy could bleed out, technically, if you don't put that tourniquet on there because he's not able to get the blood stopped from flowing. All right. So let's look at how you care for somebody. Okay, caring for external bleeding. I know it's in your packet. First thing you want to make sure you do is you apply direct pressure. Direct pressure is critical, it's essential, and oftentimes direct pressure from your hand starts the process and the procedure of getting that blood stopping the flow. You want to use a sterile dressing. A sterile dressing is a gauze pad and gauze roller. You don't want to grab somebody's dirty shirt. Okay? You want to wrap it snug, but not to the degree that it will cut off the blood flow like a tourniquet. If it's severe, please make sure that you're calling 911. That's a judgment call. I can't tell you what severe is. That's something you're going to have to look at and say, oh boy, I don't think I can stop this. Or oh boy, I better make sure that I call 911 just in case I can't get this stopped. I highly recommend, before you touch somebody's blood, if at all possible, you have gloves on. No, you're not going to have them, you don't walk around carrying them in your back pocket or something. But if you're hiking, it doesn't hurt to throw something like that in the back of your backpack, especially if you're a regular hiker. Okay? If you can have somebody go and get you gloves, do that. You don't know what people have. We don't want to subject ourselves to getting ill by being a good person. When you're done with caring for them, if you jump down here and look real quickly, make sure when you take those gloves off, and I've taught you how to take those gloves off, you wash your hands. As you're wrapping them, you continue to wrap over that wound, and if blood is seeping through, you wrap over that bandage. You do not peel it off, even if blood is seeping through. If you get to 3 layers, 4 layers, and it's still bleeding through there, that is a very serious cut, a very serious injury. So hopefully you've listened to what I said in terms of calling 911. Once you get that blood stopped, if it's that serious of an injury that they can't advance in whatever you're doing, monitor them and keep them reassured that you'll get them the significant help that they may need. Okay. When we convene tomorrow, I will teach you how to wrap. We'll do a hands-on test, and then we'll move into internal bleeding. And what you'll find is the steps that I talk about in terms of internal bleeding and shock are identical. Signs and care. Okay? Questions about today's material? Anything from anyone? Think of anything, you can ask me tomorrow. Remember to bring your gauze roller and your gauze bandage tomorrow.